Do you have a chronic runny nose and you've tried a lot of nose sprays and are still having symptoms? Then there are procedures out there that ablate what's called the posterior nasal nerve, which is the nerve that stimulates sympathetic parasympathetic system, which is a special nervous system that can make your nose run. Now, many people have a runny nose from allergies. So you get sneezing, runny nose, nasal congestion, itchy nose, itchy eyes, and that can often be treated with an over-the-counter antihistamine, especially at bedtime, or nose sprays like a steroid nasal spray or antihistamine nasal spray, and that usually takes care of it. But there are people that have what's called non-allergic or vasomotor rhinitis. Rhinitis just means runny nose, right? There are people that have a nose that runs when it gets cold, that runs when they eat. And the runny nose when you eat which can be kind of a hassle if you've got to dab your nose with a Kleenex every time you go to dinner, especially with your family. And you can imagine it gets very annoying. That runny nose is caused by a little mismatched wiring. So if you can imagine, as you get older, the nerves that cause you to salivate when you eat also start sending a signal to make your nose run when you eat. There are some nose sprays. One of them is called ipratropium bromide that you can be tried on, and that often will dry the nose up. But in people where that works, and you get tired of using it, there is a procedure to cauterize using what's called radiofrequency energy to heat up, cool off, overlying the nerves in the back of the nose that cause this to happen. And a lot of times you cause some changes to the nerve and basically an injury to get them not to work as much and to cut down on that runny nose. That's called the Rhinaer procedure, something that we do in our office. What that involves doing is coming into the office to see someone in our practice, an ENT, to be evaluated for this. Now, we'll make sure that you've been appropriately worked up, that you've been worked up for allergy, you've tried anti-allergy medications, that you've tried other nose sprays like the ipratropium bromide. For people that get relief with ipratropium bromide, they often will get relief with Rhinaer. You will often get a scope in the nose, which is where you take this small metal rod and look in your nose with the scope. I spray it to numb it first. I'm able to look in the back of the nose to make sure there isn't evidence of chronic sinus infection or polyps or anything obstructing the nose would cause it to block up and run. At that point in time, if you are a candidate for Rhinaer, we would go over the risks and benefits. There's really a very small risk of having dry eye that's almost unheard of these days with this procedure. There's bleeding and infection is a small risk. But most of the time, this is very well tolerated in the office. What the procedure involves doing is to decongest the nose so it's more open, and then to put some numbing medicine in there, which involves putting a spray, doesn't taste the greatest, a gel, that's a stronger numbing medication in the nose while using the scope to visualize in the back of the nose where the nerve is by putting the gel there, and often will inject into the back of the nose to really get it numb. Might have a little bit of racing heartbeat from the medication and the injection, but that goes away within a minute or so. Once your nose is numb, then I'll look with the scope and take the device, which is a small wand, which has a couple of electrodes on the end, and then it heats up and cools off over about a 15 to 30 second period. And I do that in multiple spots at the back of the nose, kind of moving along and then back on what's called the turbinate at the back of the nose, all of the areas where this nerve might run so that there'll be enough of inflammation and we call ablation of the tissue that the nerve will stop functioning as well. Now, nerves do regrow, and over years, you may have some return of the runny nose, but most people get a significant improvement in this. It's not always a home run, but if we get a double or triple, we're going to be happy because it means you're not having to blow your nose or blot your nose all the time with your nose running. As far as recovery, you're going to have crusting in your nose afterward for a week or two. Often when you come back at a week later, I'll have to numb your nose, look with the scope and clean out the crusting. And we're going to ask that you do some saline rinses of your nose to help debride and get all the crusts that are there out so you can breathe better after that. Right now, there is an actual code for this procedure, and Medicare will cover this. Some commercial insurances cover it, some don't. That may be changing as time goes on, but it's definitely covered for all Medicare patients. And just know that this is something that's more common as you get older. And again, the thing to look out for is I don't have sneezing, I don't have runny nose, I don't have allergies. My nose runs all the time, especially when I eat.